This is somebody who actually wore the equivalent of surgical mask for her entire travel from Wuhan to London, even though she didn't have symptoms at the time. She also went, because of her awareness of the risks associated with travel to Wuhan, she went straight into isolation in her home when she returned home. The only time she's been out of her home since then is to hospital.
The province of Ontario has now confirmed its third case of the coronavirus, bringing the total to 4 in Canada. But this case came from a patient who initially tested negative. Still, the Ministry of Health is assuring the public that the risk remains low. Here's what we know. The infected patient is a student at Western University in London, Ontario, but doctors say she has not been to campus since returning from Wuhan on January 23rd. They say she had a very mild illness and has already recovered since being tested twice at the University Hospital in London. But the woman, who is in her 20s, continues to stay in isolation at home where she lives alone. Now, health officials explained today that her case has now been classified as positive thanks to a new type of test.
In this evolving situation, our laboratory systems are moving quickly to keep upping the quality and assurance of the testing, and they're cross-referencing all the time, and Dr. Allen's here can answer some of those questions. So that during that time, with cross-referencing with even more specific and more different testing, different type and more specific one at the National Medical Microbiology Laboratory, they contacted our lab and said one of their tests came back as positive, weakly positive, and they had discussion on that basis there. And as med microbiologists do, they'll say, well, I think in this case, on a precautionary basis, we should switch this one from a negative to a positive, even though the level is very low, and the sense is that the viral load was very low as well.
The ministry confirmed that they are retesting 16 other cases in Ontario. That testing is almost complete, but so far those remain negative. Health officials believe that proper protocols were followed at London's University Hospital, and there's no further risk to Ontarians. The Public Health Agency of Canada and the World Health Organization say they don't have any evidence that someone who isn't presenting symptoms can pass on the virus. And since this woman did not have symptoms during her trip home, officials will not be releasing her flight information at this time. And an update now on Ontario's first confirmed coronavirus patient. Sunnybrook Hospital says the man in his 50s condition has improved to the point where he no longer requires inpatient care. He has been released from hospital and is now in self-isolation at home, along with his wife, who was the second confirmed case in Ontario.